And this is Healthcare Bill part number 63. And we are going to go back to page number 56. We're going to go to letters G and H. And as we've been talking about here, we've been talking about the responsibilities of the Secretary of Health and Human Services. He is, by regulation, establishing a criteria to certify health plans as qualified health plans. You can have a health plan, but it may not be qualified by the Secretary of Health and Human Services. Okay? And so therefore, these are his qualifications that they have to meet in order to become considered a certified health plan. Now, we're going to go down here to letter G. It says, utilize the standard format established for presenting health benefit plan options and provide information to enrollees and prospective enrollees and to each exchange. Now, enrollees are people that are already on a health insurance plan. Prospective enrollees are people that are going to be on a health insurance plan. And these exchanges are the healthcare exchanges that have been talking about so much on the news, and we'll get back into that soon. Okay. In which a plan is offered on any quality measures for health plan performance endorsed under Section 399JJ of the Public Health Services Act. Now, if you go to Title 42 of the United States Code, go to Chapter 6A, go to Subchapter 2, and go to Part S where it says Healthcare Quality Programs, you will find Section 399JJ. That's where it is. All right, you can read that up for yourself. If you want to comment on it, I'll be happy to do a video about it. Okay. Now, again, it says we're now on page 57. We finally made it to page 57. It says, rule of construction. Nothing in paragraph 1C shall be construed to require a qualified health plan to contract with a provider described in such paragraph if such provider refuses to accept the generally applicable payment rates of such plan. So a qualified health plan doesn't have to form a contract with a provider if the provider refuses to accept the generally acceptable payment rates of such plan. Okay? I guess the best way to translate this is if you have health insurance and the doctor or hospital refuses to accept the payment rates of the healthcare plan, then the healthcare plan does not have to contract with that caregiver. Okay, rating system. The Secretary should develop a rating system that would rate qualified health care plans offered through an exchange in each benefits level on the basis of relative quality and price. In other words, you'll be able to tell which ones that the Secretary of Health and Human Services endorses and which ones he doesn't. The exchange shall include the quality rating in the information provided to individuals and employers through the Internet portal established under paragraph 4. Enrollee satisfaction system. The Secretary shall develop an enrollee satisfaction survey. In other words, when an enrollee tries to get on a health care plan, they can fill out a survey which is sent to the Secretary of Health and Human Services. That would evaluate the level of enrollee satisfaction with qualified health plans offered through an exchange for each such qualified health plan that has more than 500 enrollees in the previous year. The exchange shall include enrollee satisfaction information in the information provided to individuals and employers through the Internet portal established under paragraph 5 in a manner that allows individuals to easily compare enrollee satisfaction levels between comparable plans. And then we get into Internet portals. And it will now describe what an Internet portal is. I will continue this in Healthcare Bill part number 64. I will tell you more in a future video. Stay tuned.